Tons about the microbiome.
Mm-hmm.
Microbiome is, totally tied to aging. And they call it, that whole microbiome aging connection, just like we have the gut brain and the
Mm-hmm.
gut skin. And I heard several lectures on the microbiome, one from a woman physician who was using familial fecal transplants
Oh yeah.
to treat various conditions. I thought it was super interesting. They were looking at sequencing in kids who have all kinds of medical problems like long COVID or
Autism, right?
autism, exactly, bipolar disorder, all kinds of different things, not just children, but adults as well. But she had actually treated some kids with autism with familial fecal transplants. So connecting all of these dots again, to how we age, health span, lifespan, and in her case, treating lots of interesting conditions, or at least looking at those conditions. I also heard a lecture on the microbiome and polycystic ovarian disease
Mm-hmm.
or syndrome, PCOS, and how you have to really look at the gut microbiome in those patients, because the gut microbiome influences our ability to, our insulin sensitivity, basically, and how we regulate glucose metabolism.
Mm-hmm.
And we know that's a huge problem in that patient population. So that was, again, a super interesting talk.
Assessing the gut microbiome, though, first of all, is not fun, and second of all,
Poop.
yeah, yeah,
Lots of poop exhibits at
yeah.
this
There were
meeting, right?
there were lots of little poop emoji things all over. But the other thing is, you wonder how sensitive it is. That was the big takeaway I had was, is it a snapshot in time with the gut microbiome? Do you need to do it serially? They talked about that. We know butyrate as a short chain fatty acid is anti-inflammatory. Right. You want to increase butyrate. Yeah. And then there was another bacteria that they wanted to increase. It starts with an A. I don't remember. Patty, do you remember what it is? With
no,
the A?
I couldn't pronounce it.
Oh,
That's
my goodness. I couldn't either. They were saying it like it was nothing. And I was having to felt like it was Greek. But yeah, there's this one bacteria that we need to increase the load of in our gut in order to be healthy as well. So much more for us to learn on the gut microbiome, just as medical doctors, and how we take advantage of it. But, I give a lecture on rosacea in the gut, and I through my research on that lecture, it really came to the conclusion that this idea of fecal transplant may be so important, not only for rosacea, but lots of inflammatory disease in the skin, because it could all be related to the gut. And I'm sure our integrative derm colleagues are like rolling their eyes right now. Like, we've been saying this for 20 years, Ted, where have you been? But, sometimes it takes me a while, but I'll get there.
It takes us a while. Exactly. SIBO, I know, has been shown in rosacea.
Mm-hmm. Yep.